Whenever we eat food, especially a large meal, small amount of breakage occurs in our intestinal mucosa or intestinal barrier. It is supposed to be intact, but it occurs all the time. Everybody gets it. Now it becomes a problem when it's too much, and that is called leaky gut. Leaky gut is a phenomenon which was not previously recognized very well, but now with tests and technologies that are developed, now we know that this actually occurs and leads to a lot of inflammation in the body. So what happens is a small amount of food particles or protein molecules which are not properly digested, they enter the body and trigger the immune system, which makes antibodies, and then we end up with all kinds of cascade of reactions which lead to symptoms. So vast majority of the times people don't have any symptoms. Sometimes they have mild symptoms, but then there are some people who have quite a few significant symptoms, and these symptoms range from anywhere from generalized fatigue to body aches, body pains, joint aches and pains, skin problems, sinus problems, allergies, migraines, and gut symptoms, for example, constipation, diarrhea, and even gas and bloating and things like that. So anyway, if you are suspecting that you might have exacerbated form of leaky gut, or you might have leaky gut which needs to be repaired or fixed, then we can do some testing on those lines. And the test basically involve two different types. One is a direct test of the leaky gut, which is called zonulin. Zonulin is a molecule that can be detected in the blood after a meal, and the presence of this molecule basically means that you have leaky gut. It can also be tested in the stool test. Now this test is quite expensive, and sometimes the insurance doesn't cover it, so we can use a proxy test, which is basically the food sensitivity test. So that is a blood test, and if your lab shows that you have quite a few positive food reactions, then it means that your immune system is making antibodies to different foods, which means that you possibly have leaky gut and it needs to be repaired. So once we've established that you have leaky gut, what do we do about it? Well, we can do a 5-hour gut protocol, which was developed and designed by functional medicine doctors, and it's quite effective if done properly. The 5-hour gut protocol has 5 components to it. So the first R stands for remove, which means removing all those foods which are possibly triggering the immune system to respond. So whatever the foods showed positive on your test, we try to remove those foods from the diet, at least temporarily, at least for 3 to 6 months, to give some rest to the immune system. The second R is basically replacing the gut with digestive enzymes. So there are all kinds of digestive enzymes available over the counter. So a good pharmaceutical grade digestive enzyme product would be helpful. Also a prescription can be used for this purpose, but sometimes the insurance doesn't cover it. So in that situation, an over-the-counter formula would be quite reasonable. The third R is basically reinoculating the gut with healthy microbiome, because oftentimes people with leaky gut have an imbalance in the microbiome, and they have too much of bad bacteria and too little of good bacteria, or they just don't have enough diversity. So what you want to do is you want to get a healthy microbiome, and you can get a good product in the form of probiotics for this. Now the probiotics are available commercially. There are all kinds available, and oftentimes people get confused as to which one to use. It's largely because there is not enough scientific data behind individual probiotics. So one of the ones which is quite good and has quite a few studies done is called VSL number 3. It is a very good probiotic. It has at least 8 different strains, and it has a very large quantity of probiotics also, but it's quite expensive. So I don't usually recommend it as such, because then people end up spending a lot of money on it. So what you might want to do is you want to just look at the 8 strains that this contains, and then go ahead and buy one from the market which is not as expensive but has all these different 8 strains. The reason why VSL3 is very expensive is because it has FDA backup, so there is a patent on it, and that's why they just sell it for a higher price. But you will not lose anything if you just get another a commercially available probiotic with a reasonable price, which just has all the 8 strains. And make sure there are at least 20 million or billion, as in B, colony forming units present in one capsule or one serving. And you go ahead and start taking the probiotics. Of course, do this also for at least 3 to 6 months. Now, if you have another condition, for example, SIBO or something else which can exacerbate your symptoms, then you might want to pause and check on those things first and take care of those problems first, because it can get worse if you have another gut condition, for example, SIBO. The 4th R of the gut protocol is basically repair. So what we do is we repair with glutaime or aloe vera or any substance that will basically heal the mucosa of the gut, so you don't keep on getting insulted again and again whenever you eat food, because we all have to eat. Lastly, the 5th R of the gut protocol is rebalancing. So rebalancing is in the form of stress management and making sure that there is no additional trigger in your system which might be exacerbating leaky gut. So with the help of all these 5 pieces of the 5R gut protocol, hopefully your gut will get back or restore back to normal, and you will start getting relief from all the symptoms. So I hope this is helpful. Thank you.